local MS Society chapter wanted me to talk to them. I said, sure. I got interviewed by the clinical advisory committee who thought my message was dangerous, which was, you got to improve your diet, work with your medical team. And I got banned.
How did you connect the dots to really understand that the was something to really focus on?
And so now we've got a big study, a 2-year study that's underway, comparing a ketogenic diet, a Paleolithic diet, and usual diet with information about the dietary guidelines diet. It's a 2-year intervention. We anticipate having our last study visit in July of 2026. We have 162 people in, one of the largest, longest studies, and certainly the largest that has MRIs as part of the study.
It's met with this open air of skepticism and how dare you and why would you know what I mean?
We are all like that.
Yes.
All of us understand the world based on our previous experiences. And if there's new information that doesn't fit with my understanding of the world, I ignore it. And you ignore it, and all the listeners, we ignore that as well.
But can this be applied to other autoimmune conditions or other disease processes?
It's been very helpful for many rheumatologic autoimmune problems: lupus, rheumatoid arthritis, Sjogren's, psoriatic arthritis, inflammatory bowel disease. They discovered my work, implemented the concepts, and the quality of life dramatically improves for that child or that young adult or that, older adult. It's not that they don't still have cystic fibrosis, or in this case, this one child had Mitchell syndrome, a severe demyelinating disease. What they discover is that
Welcome to the Longevity Formula with Dr. Brandon Crawford. Let's explore the new era of wellness.
Hey everyone, welcome back to the Longevity Formula podcast. I'm your host, Dr. Brandon Crawford. In today's episode, this is truly something special. I had the absolute honor of sitting down with someone whose work I've followed and respected for years, Dr. Terry Wahls. Dr. Wahls was diagnosed with progressive multiple sclerosis, told she was on a path to permanent disability, and yet she flipped that narrative. Through deep research, a mitochondria-focused lifestyle, and relentless curiosity, she not only halted her decline, she reversed it. And in the process, she created the Wahls Protocol, which has now helped thousands reclaim their health. In our short conversations, we dive into the science, the setbacks, and the emotional moments that fueled her transformation. We talk about nutrition, resilience, functional medicine, and the powerful idea that healing doesn't always come in a prescription bottle. This one's not just for people with MS or autoimmune conditions. It's for anyone who wants to understand what's truly possible when we give the body what it needs to thrive. Dr. Wahls, thank you so much for joining us. I am such a fan of your work. I've been actually studying the Wahls Protocol, and I've been implementing several different things that you've brought to the world ever since I've been working clinically with patients. Those that are not very aware of your journey, your story, do you mind introducing them? Do you mind giving us the rundown?
Sure. So in 2000, I developed a weakness in my left leg while I'm out walking with my wife. And a few days later, I see the neurologist who begins the workup. We do an MRI of the brain, the spinal cord, a spinal tap, a bunch of nerve conduction velocities. And he tells me I have relapsing remitting multiple sclerosis. I do my research. I find the best MS center in the country. I take this newest drugs. Now I'm aged 45. Within 3 years, I've converted to the secondary progressive phase of the illness. I take mitochondria-focused, I take Tysabri, the new biologic. Neither drug helps. I have then switched to Cellcept. And that's when I begin experimenting on myself, reading the basic science. And I will eventually create a supplement cocktail, super helpful in slowing my decline. And I'm really focused on creating supplements for my mitochondria, because I think mitochondria are what's driving disability. By 2007, I can no longer sit up. I have trigeminal neuralgia. The electrical face pains are relentlessly more severe. And it's very clear that I'm destined to become bedridden by my illness, probably demented by my illness, and probably dying with intractable, horrific electrical face pain. Now, fortunately for me, I discovered the Institute for Functional Medicine. I take their course in neuroprotection. I have a longer list of supplements. And I discovered electrical stimulation of muscles. And I convinced my physical therapist to begin that, add that to my physical therapy. And then I had this big aha, and Dr. Crawford, I'm laughing at myself how long it took to have this aha. What if I redesigned the paleo diet that I've been following already for 5 years based on this long list of supplements? So that's a few more months of research, and I have this new, very structured Paleolithic diet, and I start that new way of eating. Within 2 months, it's very clear my fatigue is markedly reduced, my mental clarity is improving, and my physical therapist says, Terry, you're definitely getting stronger. He advances my exercises. And in 4 months, I am walking in the hospital with my walking sticks. And then in May, and this is about 8 months into electrical stim, 6 months into this new diet, I tell my family I want to try riding my bike for the first time in 6 years. And we all get in a position. My son's going to jog alongside on the left, my daughter on the right. So he's 16, she's 13. Jackie will jog along behind. And I bike around the block. And of course, I haven't done that in 6 years. That big 16-year-old boy, he's crying. The 13-year-old girl, she's crying. Jackie's crying. I'm crying. And if I really relive that moment, tears still come back to my eyes. I bike a little bit more every day. In October, Jackie signs us up for the Courage Ride, which is 18.5 miles. And I cross that finish line. And of course, we're all crying again. And it really changes how I think about disease and health. It will change the way I practice medicine, and it will ultimately change the focus of my research. And I've since made it my mission, Dr. Crawford, to teach others, physicians and clinicians, how to use these concepts in their clinical practice. And I teach the public how to use these concepts to better manage their complex chronic disease states.
Absolutely. And the world is a better place for it, for sure. Your story is just so amazing. And, we have a saying in our practice, we say never accept never. And that's definitely the mindset and the attitude that, you kind of hear brewing just in your story there. I am curious because I'm a photobiomodulation guy. I love laser and light therapy. And obviously that leads me to read a lot about mitochondria and have to study the mitochondria. How did you connect the dots to really understand that the mitochondria was something to really focus on?
Well, when I was seeing the relentless decline, I decided to start reading the basic science for Alzheimer's, Parkinson's, Huntington's disease, ALS. And in all of those diseases, I saw that mitochondrial dysfunction and inadequate generation of ATP was the driver of atrophy and disability. And I really only had 2 relapses in my disease course. So it was the progressive phase. At first I focused in on supplements for my mitochondria. And then, when I discovered functional medicine, the course I took on neuroprotection talked a lot about mitochondria. So I was super jazzed about all of the supplements, so I had a much longer list of supplements. And then, really the magic happens when I restructure that Paleolithic diet. And as I recovered, my heat tolerance, greatly improved. So then I went back to taking saunas, and I'd eventually switch to a near infrared and red light sauna. And I do red light therapy, yes, as part of my self-care. And that's part of what I teach my tribe to utilize as well.
That's amazing. I'm curious, as you were navigating this, were you met with a lot of skepticism from your colleagues, or?
Well, yeah, of course. So when I first started, talking, it was to the organic grocery store. Then the local MS Society chapter wanted me to talk to them. I said, sure. I got interviewed by the clinical advisory committee, who thought my message was dangerous, which was, you got to improve your diet, work with your medical team. And I got banned. So I kept, just going where people wanted to hear me talk. My chief of staff then called me into the office to say, Terry, people are complaining about you, and I hear you're a banned speaker. What's going on? So I had to, sort of explain what I was doing. And he said, well, I'm going to send you off to the complementary alternative medicine clinic because you need to learn how to talk about this in the public space. And in your medical records, you're not upsetting your colleagues, because if you get an anonymous complaint, you're going to get your practice reviewed by the clinical advisory committee of the board of medicine, and they could pull your license. So I went to the complementary alternative medicine clinic, and I did learn how to be much more explicit that I'm supporting physiology, I'm improving the health of your microenvironment, and your cells will do whatever they're going to do. And this is a non-FDA approved treatment. So as I focused on, I'm not treating your chronic disease, I'm trying to create a better environment for your cells, that message was better received by my colleagues. And as I started publishing, we're doing our clinical trials, and my chief of staff, by the way, was very supportive of giving me protected time to do my clinical trials. And every year there is the Internal Medicine Research Day, the College of Medicine Research Day, and we present our research. And it was, remarkably positive, that first single-arm safety and feasibility study, and then larger randomized controlled trials or parallel randomized trials. And, we show that our interventions, people can do them, that we don't have serious adverse events. Blood pressures improve, blood sugars improve, fatigue goes down, quality of life goes up. And then there's this wonderful composite measure that combines walking function, hand function, and working memory. We're able to show that improves. And so now we've got a big study, a 2-year study that's underway, comparing a ketogenic diet, a Paleolithic diet, and usual diet with information about the dietary guidelines diet. It's a 2-year intervention. We anticipate having our last study visit in July of 2026. We have 162 people in. It is super, super exciting. It'll be one of the largest, longest studies, and certainly the largest that has MRIs as part of the study. And it's the longest that has a dietary intervention as part of the study. So whatever we find will be super interesting, just to show that, people can do this, that and what happens to things like their blood pressure, their blood sugar, their lipids, their patient-reported outcomes, and then the clinical outcomes: walking, hand function, vision function, and working memory.
Yes, and that's exactly what you have to do. You're doing a phenomenal job gathering that objective data, because you can't argue with that. And I'm definitely learning this. We're navigating the same situation where we've, created our own methodology and now have actually created regenerative medicine procedures as well. But it's met with this open air of skepticism and how dare you and why would you, what I mean?
But I want to point out, we are all like that.
Yes.
All of us understand the world based on our previous experiences. We recognize patterns quickly. And if there's new information that doesn't fit with my understanding of the world, I ignore it. And
Yes.
You ignore it, and all the listeners, we ignore that as well, until there's a overwhelming amount of evidence. I'm like, maybe I have to adjust my understanding of the world. Because there is so much information that we have to take in. Our nervous system has been constricting the amount of information that we have to respond to ever since we were infants. And so I think we have to be forgiving of our conventional colleagues for, yes, they're operating with their understanding of the world. What we have to do is keep building the evidence, serve the people who are curious and ready for this new paradigm. And I'm mindful that I'm not treating chronic disease. I'm creating healthy environments for the cells. And then often people are surprised at how effectively their cells rebuild a new, healthier cell and body, correctly made molecule by correctly made molecule.
Very beautifully said. Absolutely, 100%. So for those listening that are not familiar with what the Wahls Protocol actually is, Can you walk us through
Yeah.
a better understanding of that?
So it's an integrative way of thinking about how to create that better environment for my cells. So it starts with nutrition, and I sort of at level 1, 2, 3. If you include the elimination diet, 4 variations of a diet. At the first level, we're adding more non-starchy vegetables, green leafy vegetables, cabbage, onion, mushroom vegetables, and deeply colored vegetables and berries. And I ask people to give up gluten, dairy, and eggs, at least eggs temporarily, because gluten and dairy are the common unrecognized inflammation-driving foods. And I want them to reduce the added sugar in the flour-based foods. You can do level 1 as a vegetarian, or you can do it as a meat eater. Level 2 is more Paleolithic, so I encourage meat, fish, reduce the gluten, the non-gluten containing grains to 2 servings a week. And we add fermented vegetables, and we add organ meats and seaweed. And if you're using nuts and seeds, to soak or sprout them so that they are less inflammatory. Then level 3 is a ketogenic diet, so fewer carbs and more healthy fats. Level 4 would be the elimination diet, which takes out all grains, all legumes, and nightshades. If you're a vegetarian, you're going to have to continue with gluten-free grains and legumes, but then we'd want you to use a pressure cooker. That's the nutrition side. Then we talk about the ways you can reduce and monitor stress, and how to increase physical activity, how to improve sleep, how to reduce social isolation, the benefits of hormesis, so mild to moderate stress, from which you can fully recover. And you can do that through nutrition, through spices, through fasting, through exercise, through sauna or cold plunges. But you want to be sure there's enough stress, relief from stress, so you can fully recover. If there's no stress, there's no hormetic, and that can be very debilitating as well. You can think of our astronauts and people at bed rest. They don't have any stress from gravity. They decondition, they demineralize their bones, lose muscle mass very rapidly. So stress, the correct amount is very important, and recovery, the correct amount is very important. And while my preference is that people fix their nutrition first, my veterans taught me that I have to listen. Sometimes people have to fix their exercise first. Sometimes they have to fix their stress first, so that they're in a better place to begin to deal with the withdrawal they'll experience from fixing their nutrition. So it's helpful to talk with my patients. Here are the domains, nutrition, stress, sleep, exercise, social isolation. Which domain do you want to start in first? I prefer nutrition, but if that's not where you want to start, let us know where you want to start, but we want you to start somewhere.
Yeah. That's awesome. I mean, I personally have had autoimmune challenges. I've got Hashimoto's, and when I did a sabbatical, I did a 3-month-long sabbatical in Costa Rica. I was off all medication. I wasn't even doing supplementation. I was just eating whole foods. I was in the sun all the time. I was on the beach, and my stress was completely changed. And I went into full remission. It was very interesting. So the stress story has always been very integral, to my research and to things that I'm talking through with patients. It's so important. And so many people just don't really understand that or even talk about it, especially from a physician side. Your story really navigated multiple sclerosis, but can this be applied to other autoimmune conditions or other disease processes?
So it's been very helpful for many rheumatologic autoimmune problems: lupus, rheumatoid arthritis, Sjogren's, psoriatic arthritis, all the spondylopathies, inflammatory bowel disease. It has been helpful for fibromyalgia. We're now for long COVID as well. And if you follow me on Instagram, people can see that. And actually, this happens every week, every month. We get emails from followers who tell us that their family member has a genetic disorder. The medical team said there's nothing more that they could do. They discovered my work, implemented the concepts, and the quality of life dramatically improves for that child or that young adult or that older adult. It's not that they don't still have cystic fibrosis or Duchenne's muscular dystrophy, or in this case, this one child had Mitchell's syndrome, a severe demyelinating disease. Mm-hmm. What they discover is that by addressing their nutrition, addressing all these environmental factors, modifiable lifestyle factors, they get the best functioning possible for them. And if we look at the work of Bruce Ames, a brilliant nutritional biochemist, who made the observation that depending on the genetic disorder, you could use targeted high-dose supplementation to bypass the genetic inadequacies of their biochemistry. And so people have been able to greatly diminish the negative impact of Down syndrome, for example, and the negative impact of Mitchell's syndrome, which is a severe demyelinating disease affecting children. They, somewhere around 6 months to a year, they begin regressing, going back on their milestones, and need feeding tubes, and have a very, very short lifespan. This family was sent my book, and they said, read it, implement what you can. And they began implementing through the feeding tube the targeted nutrition that I talked about. And the little boy started hitting his milestones. And they got a new MRI, and his brain had started repairing the myelin. And he started sitting up and crawling and walking and climbing and doing really very well. Now, is he cured? No, but he has an amazing quality of life, and his family is so grateful. So their message is, check out the Wahls Protocol, to implement as much as you can, and be very hopeful that you can markedly improve the quality of the life for your child and for your family members.
Right, which is so important, and it changes the shift of what we're really focusing on. Right, we're not trying to cure a disease per se. We're trying to improve the quality of life of our patients, which is huge. What about those really just trying to optimize their health? Like, is this a protocol to follow for that?
Yeah, if you, I'm now 69, soon to be 70. I have a grandson, and I like to see him grow up. I want to see him become the young man, see who he falls in love with someday, and hopefully wants to start a family of his own. So I'm now visualizing I want to thrive to 120.
Yeah.
So I want to have a strong mind, strong body. So I'm going to have great nutrition, great self-care. I'm doing much more on lifting weights now because I'm thinking about chasing my grandson and carrying him around. So if you're healthy and you simply want to thrive to your 80s, 90s, 100 and beyond, this is a great program.
Yes. And I guess that kind of shifts into the mindset that, like, what you're really starting to talk about now, or what I'm hearing, right? You want to build an epidemic of health, right?
That is my mission.
Yes. And do you think that this is really where the future of medicine should be shifting towards? Like, what's your concept here?
I think, yes, we still need to have our great tools to treat disease. Absolutely. But we also want to be creating an epidemic of great cellular microenvironments. So great nutrition, great exercise, the correct amount of stress from which you can fully recover, great connections, meaning, and purpose. Which means if you don't have enough time in your clinical practice to do that, and most of my conventional physicians don't, that ideally they're referring their patients now to health coaches, to nutrition professionals, to folks in the integrative and medicine space who can help support patients who are ready to explore and deepen their skill set in these areas.
Right. So I know that people are going to want to be researching, learning more, reading your books, etc. Can you give my listeners the resources? Where can they go to find more information?
Yeah. So I want to give you a bunch of suggestions. First, follow me on Instagram, Dr. Terry Wahls, Dr. Terry, Tery, Wahls, Wahls. There you get to see what I'm eating, doing, great insights into my daily life. Then go to my website, terrywahls.com. In there, you can look at my blog, sign up. If you scroll all the way to the bottom, be sure and sign up for my emails, because then you'll see my emails, my messages, my review of the latest research updates. And I think that's super helpful. And those are the two things I really want people to do. And I think it's important that people have hope. If I can come back from such profound disability, really disability, unable to sit up, severe pain due to trigeminal neuralgia, and I was beginning to have brain fog. And now, I'm biking, I'm hiking, I'm jogging, I'm lifting weights, getting ready to run and chase my grandson who's a year, and that's super exciting to me. And, people sometimes say, well, but no one else has recovered. Well, that's not true. We've had other people with wheelchair dependence who have, and yes, it does take work. This doesn't happen overnight. It does take work.
Yes.
But in 3 years' time, they go from being unable to sit up, wheelchair dependent, to walking, hiking, and having a rich and full life. It's going out dancing with their spouse. So yes, it is possible. And part of the reason I was able to recover so quickly is I'm a former athlete. And so I really took my rehab to athletic levels of efforts and commitment. And if your listeners, if you will take your efforts to training, good nutrition, physical training, thinking of that as an athletic endeavor, however small you have to start, you'll greatly reap the benefits.
Absolutely. Well, you're such a wealth of knowledge. Your pioneering work is helping so many people. I mean, we could go on. We could go in so many different tangents, but I think what I'd like for the listeners to do is to dive into those resources, start really defining what this journey looks like for them, use your information to really start to transform their life, because what you've developed is so transformative. I mean, that's the word that keeps coming to mind here. I mean, through your life, it's transformative, but then all the different patients, all the different people that this is applied to, it's just so amazing. I'm so thankful for your work. Like I said, I've been looking at your work ever since my early days learning functional neurology. And back then, there was not a huge discussion around nutrition and how that is incorporated into neuroplasticity and whatnot. It's a conversation now, but back then, it was really your work and really just a few other things that I was looking at. So I'm very thankful. My patients are thankful. And, again, thank you for sharing with us today. And, we're just also grateful for you.
Well, keep up the good work. I love what I do. It gives me great joy to know that we are creating this epidemic. There are more and more people interested in diet, in nutrition, and that includes my neurology colleagues. When I go to the consortium of MS centers, there are more neurologists agreeing that, well, yes, nutrition does make a big difference.
Absolutely. Absolutely. Awesome. Thank you so much. Dr. Wahls' story is one of resilience, innovation, and a deep commitment to shifting the way we think about health and healing. From facing a life in a wheelchair to biking around the block, her journey is nothing short of inspiring. If today's episode sparked something in you, whether you're navigating your own health challenges or just looking to optimize how you show up in life, I really encourage you to dive deeper into her work. Follow her on Instagram at Dr. Terry Wahls. So that's at DrTerrywahls. Check out her website at terrywahls.com and explore the Wahls Protocol. There's so much wisdom there. And as always, thank you for listening, for being curious, and for showing up to these important conversations. If this episode resonated with you, please share it with someone who needs to hear it. And don't forget to subscribe so you never miss what's next. Until next time, stay curious, stay well, and never accept never.
We hope today's episode has inspired you to take that next step toward your best self. Remember, the path to longevity is paved with small, daily decisions. Your journey is unique, and every step, every choice brings you closer to your ultimate vision of a healthier, happier life. For more insights, tips, and resources, visit drbrandоncrawford.com.